today's post, we're going to be talking about why you have normal lab values even though you still have low thyroid symptoms. And we've talked about in the past how 70 to 90% of all low thyroid is due to a condition called Hashimoto's, which is an autoimmune condition. So therefore, your thyroid symptoms are actually due to an immune problem, not a thyroid problem. So what happens with Hashimoto's is that there are a few things that occur. With Hashimoto's, you're going to get this huge immune reaction occurring that occurs from the different immune cells, Th1 and Th2 types of immune cells. The Th1 side are the cells that help kill things. They're the cytotoxic cells, natural killer cells. And then there's the Th2 side, or these are the T cells. And then on the Th2 side, you have the B cells, which are your cells in your immune system that help you make antibodies. So you have this teeter-totter act going on between the Th1 side and the Th2 side. So as a result, these cells, T and B cells, produce cytokines, and a cytokine is a protein that's released from immune cells where they can go and talk to other immune cells. It is the cytokines that can actually transfer back to the thyroid and cause problems there. The cytokines can also go up to the brain and cross over the blood-brain barrier and start causing damage to the brain itself, causing a lot of inflammation, and that's where brain fog can come in. But also with Hashimoto's, you're going to get production of the antibodies from the B cells that are going to kill or destroy the thyroid peroxidase. So you can get thyroid peroxidase antibodies being produced to kill the enzymes that help the thyroid function well. So in this autoimmune condition, you're going to have antibodies to TPO, you may have antibodies to thyroid globulin, and as a result, these antibodies actually can block the receptors for thyroid hormone. The cytokines that come from the immune cells can block the receptors for thyroid hormone. So if you've ever been in New York City during the holidays and you're trying to find a parking space, it's because there's so many cars there, there's so many people visiting. When there's Hashimoto's, there's antibodies circulating, there are cytokines circulating, and as a result, these chemicals, these proteins, these antibodies actually take up the spaces where the thyroid hormones are supposed to go. So you may have enough thyroid hormones, but because of the autoimmune process, you can't get those hormones to react with the cells of the body. And remember, almost every cell in your body has receptors for thyroid, if not all the cells in your body. So as a result of circulating antibodies, circulating cytokines, you now get blockages, and even though you have normal levels of your own hormone. So this is one reason why you can get hypothyroid symptoms. So you need to find a doctor that understands these things so that they can start you on the road to better health. So I'd like to thank you for watching and make it a great day.